Welcome to the Healthful Woman Podcast, the fastest growing podcast in women's health. Today's Monday, August 19th, 2024. Today, I'm joined again by Dr. Ariana Huselid for part 2 of her story about terminating a pregnancy for medical reasons, or TFMR. As I mentioned in my intro last week, abortion is a very emotionally charged topic, and I'm very grateful that Ariana volunteered to tell her difficult story. If you haven't yet heard part 1, I recommend going back and listening to that before listening to today's podcast. All right, a few reminders. The Unexpected, the book I wrote with Emily Oster, is available wherever you buy books. Second, please do email us any questions you have for our mailbag podcast. You can either email them directly to hw@healthfulwoman.com or go to our website, www.healthfulwoman.com, and click on the link that says, send us your questions. Please remember, these questions are for the mailbag, not for your own personal medical advice. For those questions, please ask your own doctor. All right. Thanks for listening. See y'all next week. Welcome to today's episode of Healthful Woman, a podcast designed to explore topics in women's health at all stages of life. I'm your host, Dr. Nathan Fox, an OBGYN and maternal fetal medicine specialist practicing in New York City. At Healthful Woman, I speak with leaders in the field to help you learn more about women's health, pregnancy, and wellness. Ariana, welcome back on the podcast. For our listeners, you were with us a week ago. For me and you were with us 1 minute ago. Last week, you very eloquently and bravely told the story of how you decided to end a pregnancy after you got a diagnosis that your baby unfortunately had a condition that was not compatible with life, a lethal anomaly, as we call them. And when we ended last week, you had essentially just gone through the story and you'd gotten home and you were talking about sort of your process of going back to work and I guess getting back into your life, so to speak. And I wanted to pick it up from there. What was that like after even just the first few days obviously are just, hit with an anvil, but it's been months. What has it been like sort of going from that to where you are now? What kind of process has that been, or what kind of journey has that been?
Yeah. I think I've heard people say very accurately that you don't get over it. You move through it or you go through it. And that's absolutely the case. And yes, to your point, the first couple of weeks, absolutely hit by an anvil. And, grief is one of those things that it takes the time it takes. And, I'm almost exactly 5 months to the day post losing my baby. And I think there are a lot of people 5 months out who are still feeling hit by an anvil. So I just want to be really clear. That's totally normal too. I do think, it's that really intense weighted grief has lifted, not to say that it does not come back. Oh my goodness. Mother's Day, which is, also moving into like the month when like baby's starting to could come. It was really hard. That was like another anvil. One of the things I think that really struck me as being exceptionally hard, because of course there's like the grief of losing this baby. And it was also just like moving back into life and being like, well, now what? And it was so hard to think about things like, well, wait a second. So, I was due June 10th. So it was going to be like this summer maternity leave had already been planned out. And like we had already said no to family reunions and travel and put these things in place. And I had like not submitted abstracts for a conference in May because I was going to be, about to pop out a baby and and suddenly to be like, well, now what do I do? Like, now what does this look like? Oh, and like my boss was going to retire at a different time. And then he pushed it back. It's suddenly like life was flipped on its head and just trying to like put it together. And then there's just all these reminders of what should have been. We had signed up for like free samples of baby stuff. It just kind of kept coming and all these things. That was just bizarre and eerie. And it was really painful to think about, well, now what? Now we can travel, but I don't want to travel. I want to be a mom. I want to, I was looking forward to being up all night with an infant and being stuck. It's just really that like what could have been and was just unbelievable for to have that ripped from us. One of the things that I was so terrified about immediately was, how do I tell people? I can't be walking around telling people that I just lost my baby, especially now, but there's like the stigma around, how I lost my baby. And so the day of the anatomy scan, in part because I am that rip it off like a Band-Aid kind of a person, like I talked about last week, I immediately, when I got home, I called my parents and then I sent out texts, and some of them were group texts, like different groups of my closest friends and support network and closest colleagues too, letting them know what was going on and saying, please spread the word, because I don't want to have to be telling people. I really do not want people coming up to me asking me how the pregnancy is going, and can you feel I'm kicking yet? I didn't want to have to be facing that in person. And then after the procedure, I also realized I don't think it would have normally been in my nature to share about something like this publicly, but I had made the decision the month prior to share on Facebook that we were expecting. And I realized then also, well, shoot, now I've got, I've moved a lot in my life, and I've got friend groups kind of spread out through the country, and word is not going to spread. And I felt like I had to share something there if I wanted to heat off, texts and calls over the next couple of months out of the blue, asking me questions about how the pregnancy is going. So I felt compelled to say something publicly. But then, I use that as an opportunity to kind of flip it on its head. It's like, well, okay, well, if I feel like that's going to be the worst thing to do is to share something publicly all in one fell swoop, well, gosh, this is also an opportunity to share for the good of the community, to shed some light on what happened. So there was like a little bit of empowerment, like it was almost a way to take back a little bit of control. So I think I recognized through this, not only did I have everything set up for me in the best possible scenario, if you are to go through something like this with regards to getting support and it being as least traumatizing as humanly possible, but I also realized, boy, am I sitting in a place of privilege. I'm a physician. I am surrounded by a very liberal community and with people who support me. And I feel like I want to share my story. I want to share what is going through, because gosh, the face of abortion, it's not me. And it's not that those people are lesser or whatever, but it's just, to expand the horizons about this is a thing, this happens and it's terrible, especially because, going through this, I was realizing in the days after getting this diagnosis, even though I feel, confident in my decision. And again, I'm around and surrounded by a community of people who I know would support my decision, telling people to their face that I am, no, I didn't have a miscarriage, or I'm not miscarrying, but I'm actually actively ending my pregnancy. Oh my goodness, that's really hard. There's still such a fear of judgment. And if it's hard for me to say that in my position, I can't even imagine what it would be like for other people who don't feel like they have that privilege or don't feel like they're in a community that would be supportive of them. So that idea of, taking that step of sharing something publicly on Facebook was so important to just break the silence and raise awareness and start reducing the stigma.
Wow.
Yeah.
Did you get any pushback? I mean, obviously it sounds like you didn't get much amongst your family and friends. Did anyone challenge you or any way like that amongst people you know?
No, I mean, I would say there was one person who I kind of read between the lines was due to their religious beliefs.
Yeah.
Probably, I wouldn't even say because I don't think that they thought that it was the wrong thing for me to do, but probably was a little bit uncomfortable with it. But boy, there was silence. There was never anything verbalized. So
yeah. They're trying to process. I mean, how do they support you, even though the whole thing is just, it's not, it's I hear you. It's a hard position for anyone to be in. I mean, obviously, like we said, people are very emotional about this, and it's just, it doesn't compute for people. Like they can feel very emotionally about something. They're like, wait, but this person who I know and I love and I trust did this, and it sounds quite reasonable. And, but on the other hand, I'm supposed to be horrified by it. And how do I reconcile those two feelings? Because they're feelings, right? That I have inside of me, that I'm both compassionate and horrified at the same time. How do I do that? And I think because people, they're led to believe that, abortion is either all roses and unicorns, or all horror. And of course it's neither. It's like, it's in between with all things. And it's just hard for people to process that when their conversations about it are very superficial, I would say.
Absolutely. Absolutely. Yeah. And, one of the things, I realized I went on a little bit of a tangent there, but you had asked me, what was that time like afterwards? And I think I shared a little bit last time also about the importance of talking with other people who had been through similar circumstances. And that, boy, was the saving grace for me. And I dived in immediately into the TFMR community, as it's often called, termination for medical reasons. And a silver lining also of this happening in this day and age, and there are so many online communities and ways to connect with people across the globe. There are lots of Facebook groups dedicated to this topic. There are virtual support groups. The amazing clinic where I had received all my care at also has their own in-person and sometimes hybrid support group themselves. There are podcasts that are dedicated to this topic. So it was amazing to go through this and not feel alone. And that made all the difference in the world. And just recognizing that everybody's process is going to be a little bit different and what it's going to look like. But it's messy and hard. And we're not alone. Other people are doing the same thing and walking this path.
Yeah, I mean, definitely true. And I think that, again, sometimes they're in the shadows, but I do think that there has been, fortunately, like you said, more awareness, more recognition that this is a thing. And people who have gone through this, and they may not have told you because maybe they weren't as open about it. Maybe they just said, I had patients who said to me in these situations, what do I tell people? What do I tell my family and friends? And I said, well, it depends. Like it's how do, what do you want to tell them? I mean, again, it's the same thing. There's no right answer, obviously. And you could either go the direction you went, said, listen, I'm just telling people, and I'm going to not only tell people, but, lean into it and sort of make it a point of advocacy. And others, they're just not up for that. And I tell them, just tell them that the baby passed away. And then that's it. And then, okay, and that's what they tell them. And so for them, maybe it provides them some comfort in that sense that they don't have to go through the story, but then their story is unheard by most of the people who know them. And again, there isn't, I'm not advocating that one way is right and one way is wrong. They're different in how to approach it in that sense, but definitely there is more openness about it, I would say, nowadays, and talk about it, which is ironic. Maybe it's a pushback because of what's going on in the country. That's people are saying, like, because there's so much sort of, pro-life or anti-abortion, whatever you want to call it, sort of, movement in this country. Maybe it's sort of people are digging in and say, what, we have to do this. Or it could just be in general, people are definitely more open about pregnancy complications and things that happen to people than they were in the past. It's probably a combination of both, I would guess.
It sure seems like it, but I think it's a move in the right direction. And yet, absolutely, everybody has to do what is right for them. And especially in a tough situation like this. I mean, it is survival